So our group will be doing heart failure. My name is Brittany and I'll be doing the pathophysiology.
My name is Kevin. I'll be doing the etiology.
My name is Sina. I'm gonna doing at-risk population.
My name is Dennis. I'll be doing clinical manifestations.
My name is Prince. I'll be doing diagnostic testing.
My name is Tai Tien An. I'm gonna do complication.
So pathophysiology of heart failure. So it occurs when the heart is unable to pump sufficient blood to meet the metabolic needs of the body. It can result from problems within the heart, for example, infarction and valve defect. There is left-sided and right-sided heart failure, and there are various compensation mechanisms to maintain cardiac output, but however, they aggravate conditions instead of provide assistance. So for left-sided heart failure, causes are infarction of the left ventricle, aortic valve stenosis, hypertension, and hyperthyroidism. Basic effects would be decreased cardiac output, and signs and symptoms would be fatigue, weakness, dyspnea, tachycardia, orthopnea. So what causes left-sided heart failure would be A, hypertension, B, pulmonary valve stenosis, C, pulmonary disease, D, infarction of the right ventricle. So right-sided heart failure. So causes are infarction of the right ventricle, pulmonary valve stenosis, pulmonary disease. Basic effects are decreased cardiac output, systemic congestion, edema of the legs and abdomen. Signs and symptoms would be decreased output, fatigue, compensation, so tachycardia or pallor. Background effects would be dependent edema in the feet. So what causes right-sided heart failure? So A, infarction in the left ventricle, B, pulmonary disease, C, hypertension, D, dyspnea.
Etiology of heart failure. Heart failure is caused by any interferences with the heart's normal mechanism of regulating cardiac output. Cardiac output depends on the preload, afterload, myocardial contractility, and heart rate. Any alterations in these can lead to decreased ventricular function and final indication of heart failure. Some causes include disorder of coronary arteries, high blood pressure, cardiomyopathy, abnormal heart rhythm, and heart valve disorder. The first question is, what are the primary causes of heart failure? A, coronary artery disease and hypertension. B, hypertension and faulty heart valves. C, hypervolemia and coronary artery disease. And D, faulty heart valves and heart arrhythmias. Second question is, what are the precipitating causes of heart failure? A, coronary artery disease and Paget's disease. B, hypothyroidism and faulty heart valves. C, anemia and infection. And D, myocarditis and cardiomyopathy.
Risk factor for heart failure. The non-modifiable risk factor of the heart failure include A. Usually it's happen with 65 years old and the older. Gender is a woman as high risk than men. Ethnicity is African Americans. Family history is cardiomyopathy, and for the genetics. Question for the risk factor of the heart failure. Which modifiable can cause the risk factor of the heart failure? Select or apply. A is smoking. B, obesity. C, exercise. D, alcohol.
Clinical manifestations of heart failure. Right-sided heart failure signs and symptoms. Signs include murmurs, peripheral edema, weight gain, increased heart rate, edema of dependent body parts such as sacrum, anterior tibias, and pedal edema, ascites. Symptoms of right-sided heart failure include fatigue, dependent edema, nausea, right upper quadrant pain, exercise and cold intolerance. And for left-sided heart failure, signs include changed strokes and respirations, alternating pulses, pulmonary edema, increased heart rate, poor oxygen exchange, ascites, and symptoms of left-sided heart failure include fatigue, dyspnea, orthopnea, dry and hacking cough, pulmonary edema, nocturia, exercise, and cold intolerance. And for my question, which of the following is not a symptom of right or left-sided heart failure? Is it A, fatigue? Is it B, increased heart rate? Is it C, exercise intolerance? Or is it D, dysphagia?
In terms of diagnostic testing, radiographic imaging is highly recommended for gaining a visual of what's happening. Cardiomyology, which is the enlarging of the heart muscle, is a reactive mechanism for a need to pump more vigorously. It's best visualized through this X-ray technique. Fluid within the lungs can also be seen. Pulmonary edema, which manifests as oxygenated blood, backs up from the pulmonary artery back into the lungs. So my question is, what are the best two indications of pulmonary edema within a heart failure patient? And would be a reasonable cause to use a radiographic examination? A, right ventricular hypertrophy. B, left ventricular hypertrophy. C, peripheral edema. Or D, cyanosis. So serum levels in conjunction with signs and symptoms can confirm a great many deal of things. Excess thyroid hormones cause unnecessarily forceful contractions of the heart. Erythropoietin produced by the kidneys plays an important role within making red blood cells. NT-proBNP is an enzyme release that correlates with the heart ceasing to pump the way it should. So my other question is, what are certain characteristics about the blood you would be likely to notice with a heart failure patient with shortness of breath? Is it A, a T3 hormone over 210 nanograms per deciliter? B, SpO2 level below 95%. C, high albumin levels. D, erythropoietin 20 milliunits per milliliter. And E, high levels of NT-proBNP.
For the completion of heart failure, we will have the pleural effusion. Is it result from increasing pressure in the pleural capillary? And then we have arrhythmias. In the arrhythmias, we have atrial fibrillation. This is the main major cause for stroke of the people have heart failure. We have ventricular tachycardia and ventricular fibrillation. And then we have left ventricle thrombus, hepatomegaly, and the last one is renal failure. The question is, why does the heart failure cause pleural effusion? A, increase the pressure in the blood vessel. B, decrease in the pressure in the blood vessel. C, high albumin level in the blood. D, low albumin level in the blood. E, A, and D. Name of this rhythm: A, ventricular fibrillation. B, ventricular tachycardia.
This is all our reference, and thank you for your listening today.